Fistulas can develop for various reasons, and the causes may vary depending on the type of fistula. Here are some common causes. Infection. Infections of the anal glands can lead to the formation of abscesses. If these abscesses don't heal properly, they can create abnormal passages, fistulas, between the anal canal and skin. Inflammatory bowel disease, IBD. Conditions like Crohn's disease and ulcerative colitis can cause inflammation and lead to the formation of a fistula. Obstetric fistulas. These are often caused by prolonged obstructed labor during childbirth, particularly in areas with limited access to proper medical care. The pressure from the baby's head can cause tissue damage and subsequent fistula formation between the birth canal and nearby organs, such as the bladder or rectum. Trauma. Traumatic injuries, such as those resulting from surgery, radiation therapy, or accidents, can sometimes cause tissue damage that leads to fistula formation. Cancer. Fistulas can develop as a complication of cancer, especially when tumors invade nearby tissues and organs, creating abnormal connections. Sexually transmitted infections, STIs. Certain STIs, such as chlamydia and gonorrhea, can cause inflammation and damage to reproductive organs, potentially leading to fistula formation. Chronic infections. Chronic conditions like tuberculosis can lead to the formation of fistulas, particularly in the lungs or other affected organs. These are some of the common causes of fistula. Treatment often involves addressing the underlying cause and repairing the abnormal passage surgically.